Let's get an update now from the Northwest Province as part of the country roll out their vaccine programs for the health workers. Joining us now is the province's Health MEC, Mr. Madoda Sambatha. A very good afternoon to you, MEC, and thank you so much for your time today. If you could give us an idea of how the rollout process is going in your province, when did it begin?
Yes, good afternoon, yourselves and the listeners. Of course, as a province, we have received our vaccine together with all other provinces that received them last week. As we stand off now, remember in our province, we have two sites for this program. We have KT, which is Klerksdorp Tsepong, based in Klerksdorp. We then have Job Shimankana Tabane Hospital, which is in Bujanala. The total of vials that we have 8,300, with 5,716 in Klerksdorp Tsepong and the rest in JST. As we speak, as of yesterday, the report of yesterday, we had vaccinated 2,300 community healthcare workers, which included private sector vaccinations. In fact, if you check on the basis of the success, Klerksdorp Tsepong from a smaller province of us yesterday was the second highest after Steve Biko. And of course, we are happy with that because it therefore tells you the response we are getting from our healthcare workers as a province.
You mentioned, MEC, that you received 8,300 vials. How many healthcare workers are going to be inoculated from those vials?
Provincially, we have 42,000 healthcare workers, which is a breakdown of provincial health department, private sector, municipal health services, and community traditional health practitioners with community health workers. That's the breakdown of the province. Now, we're expected to deal with this number of 42,000 in a period of at least 3 months. But remember, the arrival of the vaccine from Johnson & Johnson, it's in a break of 2 weeks. So the country receives 80,000 in each 2 weeks, and ourselves as a province receive from that. As I speak with you now, the remainder that we have, it's going to be used in 9 days. And in 9 days, when we finish the remainder that we have, we will be ready for the receipt of another 2 weeks delivery from Johnson & Johnson. The program, as you look at, healthcare workers phase 1, 42,000, but the rest of the province is expected to deal with 2.7 million as 67% of the population.
Now, we understand that so far, only those who have actually registered are going to be receiving the vaccination. How are the registration numbers looking as far as healthcare workers are concerned?
No, it's not an issue of those that are registered. It's an issue that we've been campaigning provincially to ensure that all healthcare workers do register. We're aiming for 100% registration, because only when you are registered, then you can have an option to be given a consent form to choose whether you're taking it or not. So as we speak, registration of the 42,000 expected, it's largely around 20,000 as I'm speaking with you now. And of course, registration happens on a daily basis. And as you would understand, registration is done through EVDS, which is a national program. But in each facility, we do have mobile people who are moving around, helping those that could not register in facilities, so that in each moment we call people to come. We don't have a problem with the lesser number of people registered.
We understand that at the different designated sites, after a healthcare worker has been inoculated, that they have to sit there for about 15 minutes for observation to see how they react to the vaccine. Have you had any adverse reactions so far?
Yes, each side permanently, until we finish the 2.7 million, would have that arrangement. Because as per the prescriptions, there's 15 minutes observation. From the start of the process, we've not had any adverse events except a late reaction that happened to one person who was vaccinated in JST. And that person too was recalled back for a checkup and checked, and he only stayed for observation. And later the person was released and was okay. No other problem we had from that one.
And what was the reaction that this particular healthcare worker had?
The reaction was that the healthcare workers was feeling a pain, and the healthcare workers was developing some elements of rash. You'll understand that that would be an element that happens when you have not checked elements of reaction of individual. But that worker too has fully recovered and had recovered immediately after observation. It happened post 15 minutes. And remember, after 15 minutes, you give them a card of vaccination and give them form that should there be any development with you after this process, please consult the following person. And that happened, and that was attended quicker.
Well, MEC, thank you very much for that update as the country continues its rollout of the Johnson & Johnson vaccine to various healthcare workers around the country. That is the MEC for Health for the Northwest, the MEC Madoda Sambatha.